Welcome everyone. We're going to be talking about skin aging in particular today. And I actually wrote a very interesting article on the site which looks at aging and what happens to the face. And the reason why I did it is because generally when I see patients in my consulting room, and whether they're in their 30s or 40s or 50s or even older, they'll often sit down and say, oh, I'm starting to notice how lax my skin has become. And they typically point to their jowls, or they actually pull down and say, look how lax my skin has become. And they tend to pull back on the cheek area and to say, look how much better that looks. And there seems to be a misconception that the aging changes that take place is purely related to the changes in the skin, and that's partly true. As we get older, there are definitely some changes that take place purely in the skin, but unfortunately for us, there are also changes that take place while we age, not just with the skin but with the underlying fatty layer as well as the muscular layer, and finally, and also very importantly, to the actual bony layer, to our skull. And it's the combination of all of these changes that actually show or give us the changes that we see on the skin surface. For example, a case in point, when we're younger, our cheeks are much fuller, there's a lot more volume, and what creates that is actually fat. And what's interesting, what has been found, and this was only found fairly recently, about 10 years ago, a study demonstrated that the fat in our face is not the single layer. It actually consists of separate little fatty pockets. So as an example, our cheek area, which is this nice oval structure, actually consists of 3 separate fat pads. And the importance of that is that those fat pads can thin or drop at different times. And fat in our face, yes, provides shape, but importantly, when we're younger, it helps to provide support. We must almost visualize it like a full balloon. And as you let the air out of the balloon, so the skin of that balloon is not as taut, it's not as tight until you've let out the air and then it folds. And the same thing happens to our skin. So often when people come in and say, well, look, I've lost the elasticity in my skin, it's not actually just the skin, it's the underlying fatty layer as well. And also importantly, is the muscles in our face that help us create facial expressions like smiling or pulling a face. One of their roles is to actually hold up structures. And unfortunately, as we get older, those muscles elongate, they become longer. So even the structures that they're holding, those areas or parts of our face tend to drop a little bit. So we can look after our skins as much as we can. But unfortunately, the changes and in particular the aging changes that we see on the skin are not related just to the skin. It's also related to that fatty layer as well as to the muscle layer. And finally, once we get to our late 50s and 60s, the actual bone starts changing. It starts almost inverting in on itself. So the bone also provides support to that overlying fat and then the skin. But if that starts becoming thinning and turns in on itself, there's less support. So that's when we start seeing those hollows, both in the cheek area, deeper nasolabial folds, and a lot more prominent jowls. And obviously there is also a strong genetic association with aging and the changes that take place. So I'm just going to answer the first question. That's from Pauline. Thank you, Pauline, for the question. Her question is, what are the best products to use after chemical peel, and how long should one wait before using products with active ingredients like your retinol and folic acid, etc.? Now, Pauline, the most important product that you should be using after a chemical peel is sunscreen, and obviously one has to avoid sun tanning or the sun exposure as much as possible. And the sunscreen that you should use really should have an SPF 30 or even higher, and it should contain zinc oxide and or titanium dioxide. And even if it's overcast weather, remember to apply it several times daily, because the effect or the duration of the ingredients in our sunscreens are limited. It varies from one particular brand to another, but on average it can last 80 minutes, maybe 2 hours, maybe a little bit longer. So the effect will decrease after a period, and you should therefore reapply it during the day. And then after that, and after a chemical peel, what to apply on the skin, it is really dependent on what type of chemical peel. We divide chemical peels very briefly into our superficial and sometimes referred to as surgical chemical peels, as well as your medium depth and your deep chemical peels. And very simply, what that's referring to is how deep the chemical peels are going. It doesn't specifically indicate the effectiveness of the peel. It's only looking at the depth. With your superficial or surgical chemical peels, it will enter, or it will remove, the outer epidermal layer of the skin. Your medium depth peels will go into the dermal layer, and then your deep will go through the entire dermal layer and almost to the subcutaneous layer. And if done incorrectly or left on for too long, it actually can burn through the entire skin layer and cause problems because it has been applied and has actually burnt the skin too deeply. Now, I'm presuming that you mean a superficial peel. Those are the commonest. There's most probably 90-95% of all chemical peels that are done today are superficial. The advantages is that they are true lunchtime peels, most of them, because you literally can have the peel done. You can put an SPF on and go straight back to work, and no one will know. There's a very low chance of redness, of the skin peeling, etc. And generally with those kind of peels, my advice after obviously your sunscreen is to consider using a low dose vitamin C, as well as a repairing, barrier repairing type of serum or product that contains ingredients like hyaluronic acid and ceramides. That's one of the reasons why I formulated Skin Marvel. It has a low dose vitamin C 2%, but which is also very effective still as an antioxidant, and still has effects on helping to lighten pigmentation. But it also contains your hyaluronic acid and your ceramides. And what is important about the hyaluronic acid is they're not all created equally. And that's why if you look at the ingredient list on Marvel, we have a hyaluronic acid complex. And the complex consists of both high, medium, and low molecular weight hyaluronic acid. And the reasoning behind that is that your higher molecular weights will be sitting on the skin surface, drawing water and helping to provide a protective barrier. Your medium molecular weight hyaluronic acid will enter into the epidermal layer and provide a moisturization level at that particular part of the skin. And then your really low molecular weight have a much deeper penetration. They're going to the dermis, again drawing water and providing reparative and hydrating effects in that skin layer. And so that's why I just formulated the Marvel, so that particularly after chemical peels or similar type of treatments, one can apply it and to maximize the degree of repairing as well as hydration through all the layers of the skin. And then there's nothing stopping you, if the skin is not too sensitive, to actually add a vitamin C serum. I would, however, be careful if the vitamin C ingredient is ascorbic acid, because it does have a low pH, and as the name suggests, it's acidic, and that can cause an increased irritation. Your other vitamin C ingredients, like your lipid soluble, that should be 100% fine to put on. But if you're not sure with any of these active ingredients, always do a little test patch and await till the next day and see if there's any reaction. You also mentioned in particular retinol and ferulic acid. Well, ferulic acid and ferulic acid ester often come with vitamin C in serums, and so I don't see any problem with applying it. But like I said, if you're unsure, just do a little test patch. However, with retinol specifically, grain active retinol, with tretinoin, with retinol palmitate, retinol acetate, all of the vitamin A ingredients, I would consider not applying it after a chemical peel for at least 5 days. And it's also a good idea to stop retinol for 5 days and any of the other vitamin A ingredients before having a superficial chemical peel. Okay, so here's a question from Kathy. Thank you, Kathy, for the question. The question is, does losing weight or fat make your face look older? Yes, 100%. Unfortunately, it does. So we have this. We have to decide on a balance between being healthy and looking after our bodies, and being a little bit on the slimmer side, and as opposed to gaining an incredible amount of weight and having a full face and looking younger. So it's a balance between the two, and but it's exactly on the same principle, on the same basis, is that the fat in our face, sitting in those pockets all over the face, yes, provides shape, but the most important is to help provide support. And with that support, it doesn't allow us to see grooves, indents, tear troughs, indents on the temporal area, etc. And so when you don't have those shadows, you don't look tired, you don't look as grumpy, and your skin is a lot more supported. And when you do smile or move, the skin doesn't fold as much, then automatically the face looks a lot younger. The other advantage to having a fuller face is that more light is reflected, as opposed to having an indent or a groove where a shadow can be seen. And so that improved light reflex gives more of a glow to the skin, which also adds to a more youthful looking appearance. Okay, here's a question. Kathy, I hope that helps and answers the question. Here's a question from Robin Ann. Robin Ann asks, can you use retinol all the time? Or should you take a break, example, use for 3 months, then stop for a month, and then start again? Yeah, good question, Robin. Robin Ann, it's actually really up to you. There is no real advantage of stopping, and in fact, I think there will be a slight detriment. But if you feel that's what your skin is handling and that's what it needs, then definitely listen to your skin. You know, all of our skins are different. Generally, when I recommend someone to start with retinol, is we start off with the lower strengths, introduce it slowly to the skin regime, try get the actual skin used to the current lower strength, then move up to the higher strengths, and then finally until the highest strength possible that your skin can handle. And after that, my advice would be to continue it on a nightly basis if your skin can handle it. The interesting thing, though, with these kind of active ingredients, and that includes your vitamin C, your retinols, all of these active ingredients that are producing those anti-aging effects in our skin, is that there's a plateau. And for example, the first 3 to 6 months, when someone starts applying active ingredients for the very first time, is when they're going to see the most dramatic improvement in their skin. So things like pigmentation and texture and pores, glow, hydration, fine lines, all of that's going to suddenly improve, and it's going to be a visible change that the person sees. But then from about 6 or so months till about 12 months, that rapid progression starts slowing down. It's still improving, but not at that same pace as we saw in that first 3 to 6 months of application. And then once you carry on applying for till maybe about 12, 13 or 40 months around there, the effect starts plateauing. There's very slight mild improvements from a month-to-month basis, but it is definitely at a much more slower, almost plateaued, almost flat level. And the reason for that is because those active ingredients can only do so much. You're only putting a 1% or a 2% retinol on. And even if you do it every single day, that 2% has a maximum in the sense of effect. Plus, on top of it, we're actually aging. We're not getting younger as one is applying it over the months and the years. And so it reaches a plateau. And that's one of the main reasons why I've introduced the Skin Avenge range, because these are super high concentrations of those active ingredients that we know will stimulate the skin, the collagen, the elastin, improve fine lines, etc. And what that does is that now once we are getting that improvement, by adding the super high concentration, we force the skin to react, almost like getting a little mini professional treatment. And when you force the skin to react that way, when you apply your daily serums, you are starting at a slightly higher level of activation of the skin. And after a week or 2 weeks, when you do that again, and so with these spikes of cellular stimulation, we can get this constant gradual improvement. as opposed to just using our serums, which will improve our skin, but it will eventually plateau. So great question. Thank you. And I hope that's helped. Here's a question from Glossboss. Hi, Glossboss. Is retin contraindicated in cancer patients? I would think it would be, which is what I advise my client, but I thought I would ask you. It depends on which kind of cancer, Glossboss. If a person has a skin cancer and on their face and they're going to be applying the retinol, I would advise against it. I agree with you. It's a contraindication until that skin cancer has been completely resolved, whether it's been surgically removed, burnt, or ALA under a PDT type of treatment. But otherwise, a normal systemic cancer, I don't believe that there is a contraindication for applying retinol. The concentration and the strength of the retinols, even with your 2 or 3% retinols, the systemic absorption is almost minimal. And a lot of studies are saying that it's actually fine to use even if you have sun exposure the next day. There's some studies that are showing that putting retinol in the morning is fine, even although there's going to be sun exposure, etc. So the research behind retinol is definitely changing, but the systemic absorption is really not that high, and I don't think that one needs to be worried if someone has some other form of cancer except skin cancer. So I hope that helps. Carolyn has asked, thank you, Carolyn, what retinol should you use? Well, Carolyn, when it comes to retinol, at the end of the day, retinol is retinol. There are different types of vitamin A's, such as tretinoin, which is commonly found in retin A. And retin A is your prescription strength that is used predominantly for acne patients. Then you have your lower strength precursors like your retinol aldehyde, retinol palmitate, retinol acetate, retinol, which is spelled with an A. And they are used in generally, not always, but generally they are used in the lower strength type of retinol or vitamin A based serums or moisturizers or treatments. And retinol has become popular in the more cosmeceutical active ingredient or doctor dispensed type of cosmeceutical. And the other ingredient which I believe is very important to mention is gram-active retinol, which is one of the newest members of that retinol family. And if we look at the number of suppliers that supply or make retinol or gram-active retinol, there aren't that many across the world. And so the gram-active retinol that we use in, for example, the Skin Flash or in the Skin Avenge HPR is exactly the same hydroxypinaculane retinate or gram-active retinol that another company will be using or another brand. Is because simply there aren't that many suppliers. And the same when it comes to retinol. So at the end of the day, it really is the same. And I feel what differentiates when you say, well, which one should I buy and from which brand, it actually comes down to the percentage. And the first thing that I would recommend is that you do some research in the different types of brands that you are considering or that you're interested in, and ensure that they're open in their full ingredient listing, as well as the actual percentages and the exact type of retinol that is being used. And not only just to look at the label. There are brands that will write retinol 1%, but if you read the ingredients list, it's a retinol palmitate 1%, but on their bottle they've stated as the name of the product retinol 1%. So it's those kind of things that one needs to be just careful that it is true retinol and that the percentage is clearly shown or indicated by the brand. And that's how you know that you're getting the actual ingredient that you're looking for and at the correct concentration so that it has the effect that you want. So yeah, at the end of the day, good, well-known brands that are out there, and there's multiple brands out there. I would choose any retinol, but in particular with skin, we only use HPR, hydroxypinaculane retinoate, which is also known as gram-active retinol. And the main reason for that, and I think this is the reason why I went with this route as opposed to retinol, is because it is the least sensitizing retinol on the world market currently that's available for us. And it's a lot of people under they feel or think that if retinol is applied and they're getting a reaction on the skin, it goes red, it's flaky, it's itchy, that it's working. And if you put on retinol and it's not doing that, it's not working. And it's not true. There's no study that shows that you need to react and have a reaction, and the more severe reaction, the better the effect. The reason why you're getting a reaction is the conversion of that retinol or vitamin A ingredient to retinoic acid ester. Retinoic acid. Retinoic acid needs to be, you need to convert retinol into that retinoic acid, because that's the only ingredient that can bind to the receptors in our skin to have that positive effect. And why I went with grain active retinol is because it's a retinoic acid ester. It actually is retinoic acid, and so it binds to those receptors. It has no conversion process. It is that conversion process that produces the reaction. And the more conversion that's needed, the more of a reaction will take place on your skin. And so, to end the question, it's any retinol, as long as you know the concentration and as long as you know the actual ingredient is retinol. Okay, Junita, yes, thank you for the question. Will even tretinoin plateau? How do you deal with that or prevent that? You can't. Tretinoin will also plateau. Because any active ingredient, it's irrespective whether it's tretinoin, whether it's ascorbic acid, whether it's retinol, whether it's grain active retinol, it's ascorbyl phosphate, whichever of those active ingredients, ferulic acid, etc., the effect when applied on a daily or twice daily or every second day, whichever approach that you have with your skin regime, is you're going to eventually reach a plateau effect, because it's the same ingredient, the same concentration that's being applied, and the skin can only be stimulated to that degree. And that's the reason that professional treatments exist. For example, chemical peels, dermapen, laser, particularly fractional lasers, is because it's all of those treatments, all they're doing is kind of the same thing, is in that they are stimulating those skin cells to another degree to produce an effect. And the more aggressive that we are with that stimulation, the better the effect. But obviously, the more aggressive we are, there's a higher potential of side effects that can happen. And that's why, for example, with very deep aggressive lasers, some people have side effects like burns or scars or pigmentation problems. But that only happens generally when the setting is incorrect or etc. So when it comes to an ingredient and how you can prevent it, you can't. That's just how the skin is. You can get further responses by adding other treatment modalities to it. The one way to help reduce the plateau is to add higher concentrations, very similar to the concept of skin avenge. That's why I formulated it, but exactly because of that plateau. You want sudden high concentrations to almost give you those mini treatments, but you can do it at home to stimulate the skin. The Skin Avenge Glyco is an excellent example in how to improve the effect, because it's like a chemical peel done at home. But the advantage is you can do it once or twice a week, and you can actually follow that with a retinol-based topical treatment, and that will boost the effect. And that, I'm not sure if this will be now asked because I've mentioned it, is that you will read that one shouldn't combine alpha-hydroxy acids and retinol. There is no scientific reason for it. It's a sensitizing a potential of the skin when you combine those two. But when you combine glycolic acid followed by retinol, your improvement in the skin is increased, as long as your skin is not very sensitive and that combination doesn't sensitize you. And just want to see I've answered your entire question. Yeah, how do you deal with it? By trying to stimulate the skin more, and you can't really prevent that. Okay, then I see here's a question from Laura. Is it possible to formulate a product that claims high active ingredients for less than 500 as a retail price? Laura, a good question. I don't believe so. the majority of our ingredients, if not all of them, 99% of them, are basically come from international suppliers. And when you look at it's actually quite, it's quite interesting when you look at the cost of those ingredients and all the individual ingredients. Once they get shipped to you, then you add your customs duties, then you add the formulator, you add the compounding pharmacist who then puts it together for you, and the actual filling, it actually becomes quite an expensive process. And believe it or not, the majority of expense in any brand is actually the ingredients. So I do not believe that one can, with those type of international active-based high concentration ingredients, be able to produce a formulated serum or a moisturizer or any skin product at a retail price less than 500. I don't believe it, and I know that some people are going to ask me, well, how does the ordinary do it, or etc. I've often asked that question myself. Knowing and looking at the price of the ingredients, I think that the easiest answer is just for you to look at what I've just said, is that I don't believe I don't believe it's possible. Okay, next, what alternative ingredient can be used in place of retinol when pregnant? I would stay away from anything that's vitamin A based or even vitamin A similar while one is pregnant, including the Bocachiol, which is like a retinol alternative. And the very simple reason is that, yes, I know it's plant derived, but I don't believe that enough studies have been done to show that it is safe. And why take the chance? And so stay away from anything that contains vitamin A or retinol, even although what I said earlier is that the systemic absorption is minute and most probably negligible, and that it won't have an effect. I still, as a medical doctor, would never advise a patient that's pregnant to consider, just because of the potential or the possibility. Even if it's small and minute, you just don't want to take that risk. And so what I would stay with from an active ingredient list when you're pregnant is look at your vitamin C's and your hyaluronic acid and your ceramides, and things like glycolic acid to carry on stimulating your skin, like a glycolic acid chemical peel, or like the Avenge Glyco, where you can do it at home once or twice, just to constantly exfoliate and stimulate that skin. And if you're doing it for a 9-month or a little bit prolonged because you're breastfeeding, your skin will still respond nicely, and it won't need that retinol during that period. And knowing that after that period you can start the retinol again. So yeah, thank you. That's a good question, Nix. I've got another one here from Bella. Can you re-stimulate the skin by applying the same product but more often? No, you can't. That's a good question. You need high concentration. It comes down to concentration. And in fact, if you, for example, let's say you apply a cream and then wait 20 minutes, then you apply this exact same cream, you're getting the same concentration. What may happen is that you irritate the skin and overly sensitize it, but you can't re-stimulate it by applying it several times. You need something that gives a spike, and that normally means a higher concentration, or considering a professional treatment like a chemical peel or Dermapen. Okay, so thank you, Bella. And then here's a question from Robin Am. Can pigmentation appear darker when you start retinol? Robin Am, it can. And the very simple reason is because as the skin starts to exfoliate and as pigment starts getting drawn closer to the skin surface, it will appear darker. What we see on the skin surface is literally the tip of the iceberg. And pigment can extend all the way down into the dermis. And that's why often, if we take a topical regime and only use a topical regime to help get rid of pigmentation, it often takes a very long time, because you've got years worth of damage that's produced the pigment. and you're now slowly drawing that pigment up from that deep dermal layer. So as it gets drawn, and so you keep on seeing the same pigment, the same pigment, the same. Meanwhile, it's actually less in that dermal layer. And so it can take very long, 6 months, sometimes 8, sometimes as long as 12 months. But yes, 100%, as that pigment gets drawn close to the surface, it can appear darker, and it can stay darker for several months before it starts lightening. And so unfortunately, yes, that can happen. You can speed up that process by looking at IPL, intense pulse light, and you can also use dermapen with retinol to speed up that process. Very simply, what is done is that a retinol, which is safe to use during needling, is applied onto the skin. You add your gliding gel and you just dermapen over the pigment. And some chemical peels, like your glycolic acid peels, are very good, in particular for superficial hyperpigmentation. And in fact, glycolic acid is your first line treatment even with melasma. Is just to start exfoliating and removing that superficial layer of pigment. So thank you, Robin, and I hope that answers the question. It's actually, we're at 1:30 at the moment, so I'm going to have to, our half an hour is over, unfortunately, and I've got one more question which I'll answer, and then I'm going to have to say goodbye. However, just to let you know that I am talking and answering questions on Facebook Live as well, and that's in about 10 minutes, is that right? Yeah, 10 minutes. So we can carry on with any questions. If you do have, go to the Skin channel on Facebook and just give us those questions. And if we have any that come in from the time I say goodbye, we'll just answer them on Facebook as well. And Nix, will you extend your range in the future? Nix, I remember you from the last live chat we did on skin, and I think you asked the same question. You're obviously very excited about the brand, and thank you, I appreciate that. Yes, we will definitely extend the range in the future. We are working on it. We're doing quite a lot of work on professional products because we feel that's where we're really going to be able to stimulate the skin as much as possible. And so our full Pro Peel chemical peel range is now available, and we're moving on to dermapen or needling specific products as well. Anyway, so I think that I'm going to say goodbye. Thanks so much for joining. It's been an absolute blast. I've learned a lot. Thanks for those questions. And sorry, must I see something before I go?
Just thanks to Vicky.
To Vicky. Thank you, Vicky. As Sam's highlighting, thanks so much. I appreciate that. And take care, everyone. And we will do this again in the near future. And so please stay tuned on our social media, and we'll let you know. So thanks so much. And I'm going to say